Well, hello, Dr. Rogers, Nikisa. It is very nice to see you. Thank you so much for joining us today, and for being a key player on our Team Vitamin D at our on our trip to Washington, D.C. and Capitol Hill. So, Dr. Rogers is here today to talk about her experience with Grassroots Health and our wonderful team. We had several others join us from other organizations there in DC to represent our maternal vitamin D initiative. And so, can I just call you? I'm just going to call you Nikisa, if that's okay. Can you
That's
please tell everyone a little bit about yourself and how you became interested in vitamin D?
Yes, thank you so much for having me on today. And Grassroots Health has been an amazing organization to work with. I'm a radiologist and I specialize in breast imaging. And I first became alarmed by the increasing incidence of cases coming into my practice of early onset breast cancer. I mean, women in their 30s, early 30s, below 40. It started with two young women in particular, and I just have been seeing a continuing number of just early onset cases that I never used to see in my practice. I've been doing this for 20 years. So I became very alarmed and I went to the literature to try to figure out what was going on. And then I saw that, that cancers in general have been increasing in younger people, and scientists, point to different factors. And one of the factors I saw was vitamin D. And that's what led me down the rabbit hole of vitamin D and learning all about how it impacts every aspect of our health. And also, there's association of vitamin D deficiency with increasing risk for cancers, including breast cancer. So that led me to looking at that avenue. And from there, I also was analyzing how Indiana has a very high maternal mortality rate in general. And because I saw the links with vitamin D deficiency in maternal health. And so that led me to maternal health.
Hmm.
And then from there, I started scouring the literature and I saw a program that was done at the Medical University of South Carolina, which was conducted in coordination with Grassroots Health, and where they were able to do prenatal testing for vitamin D deficiency. And they had a significant reduction in preterm birth and pregnancy related complications by just making sure women's vitamin D levels were at or near 40 nanograms per milliliter. So I figure, well, that's a program we should be able to implement here in my state. So that's what led me to contact Grassroots Health, and that's what led me to where I am now.
Yeah, and joining our team, it was just
Yes.
perfect timing when you reached out to us. And was like, we need more people on our team. And then it was like your email came into my inbox and, oh, are you interested? Yes, yes, you were interested. Tell me a little bit more. Tell us about the nonprofit that you have also started.
So as a result, I felt very passionate about it because I just believe that our bodies were never designed to be deficient in vitamin D. And it's just only as a consequence of our modern lifestyle being sheltered inside for many hours a day. So I just felt so passionate about that I created a nonprofit, Crossroads, Health Foundation, Inc. And the mission of my nonprofit was to uh, create awareness about deficiency and how it disproportionately also impacts minority populations, but really most Americans. But it's the impact is even worse with minority with Black people. So I wanted to just raise awareness because I think a lot of people don't quite understand how many areas of health it impacts, and people just think it's not that important and they don't really understand it. So I really wanted to bridge like understanding and try to facilitate being able to advocate for more uniform testing as well as supplementation being covered
Mhm.
for low income people.
Yeah, yeah. So perfect fit to work in collaboration with Grassroots Health. So tell us a little bit about the others that you invited to join our Team Vitamin D on Capitol Hill.
Sure. So my one of my partners is Dr. Antoinette Austin Glass. She's a long-term friend. She's an anesthesiologist practicing in Austin, Texas. And she has a focus in nutrition, and she has a big interest in vitamin D. She also has a personal history in terms of being deficient and also having had two children with asthma. So, one of the other team members, Erica Smith, she is someone that I've known for many years. And her interest in vitamin D came through the fact that it's impacted her life. And she had preeclampsia with one of her pregnancies, a kid with asthma, and she recently lost her husband about a little over a year ago due to a bile duct type cancer. So
Hmm.
she has seen it, play out there as well. And she is also a long term friend, and she is more of a support person. And she is the one that actually set up my nonprofit. She's an attorney. So she's there in terms of, legal type, things that may pop up. She's always able to answer questions and whatnot. And she's also a big believer in vitamin D because the deficiency impacted her when she had autoimmune type symptoms. And she, did a Google search, and she started supplementing with 10,000 IUs a day. And then her symptoms resolved over a course of a few months. So she was definitely a big believer in vitamin D as well.
Nice, nice. So you brought a wonderful team along with you. And when we were in DC and we were meeting with our state representatives, you and your team were able to split up and have your own separate meetings throughout the day. Why don't you just share a little bit more about your experience, the experience of the ones that you brought to join us, and your thoughts overall on the day.
It was a wonderful experience. I got great feedback from all the legislative aides that I spoke with. Everyone was really interested. Many were unaware of the impact of vitamin D, and everyone that I spoke with actually had personal stories of whether, oh yeah, I'm deficient in vitamin D, or I don't get enough sun, or one person commented that they had their grandmother pass away at 28 of breast cancer. So, and they never got to meet the grandmother. So, there was a lot of connections there, and everyone was interested in terms of, what would be the next step. And so multiple people actually pointed us into a different direction with another representative to try to reach out to that actually had sponsored a omnibus bill that I believe hasn't been to the House floor. And they gave us ideas to try to get in touch with this congressperson so that we can potentially get some vitamin D wording in that bill. So that was very instrumental and helpful. And I actually have a Zoom scheduled for tomorrow with Representative Underwood's legislative aide.
That's fantastic.
And I've
So,
also, in one other experience, so my one of my meetings was actually with Congressman Rudy Yakum, and that was the final meeting of the day. And it was such a wonderful experience because he was actually voting on the House floor. And so they invited us to come over to the House floor, outside the House floor, to talk with him in between his votes. So he came out. He was just a very nice person, very engaged, very interested and in the topic. And he ultimately invited me and Tiffany to be his guests in the gallery. And so we watched actually watched the proceedings of some of the votes, and it was a really fascinating experience.
yeah, yeah, I saw your energy when you came back and joined us at the reception, and the smile on your face was good to see. So not only was the day in DC, not only did that feel like a success, you've seen the result of your advocacy efforts in terms of the follow-up that you've gotten, the connections that you've made beyond those you met with that day. So what are your next steps?
So, as I mentioned, I have a meeting tomorrow, and I actually had a second meeting that I already Zoomed with another legislative aide for a different Congresswoman, Ellsworth, who's interested in maternal health as it relates to the military. So, that meeting went well. And so I will see where the meeting goes tomorrow. And then since then, I've done a poster presentation at the Indiana section meeting for the American College of Gynecology, where I was explaining the risk of, vitamin D deficiency and how it relates to poor maternal health. And everyone was pretty receptive with that. So I'm hoping that in time I'll be able to speak more with the OBGYN doctors. So that's what I'm hoping will come out of this recent poster board that I did for them.
Mm-hmm.
And then I'll just have to see where a lot of these things lead.
Mm-hmm. Yeah, you are doing such a fantastic job at generating all this energy around vitamin D and the message that we're sharing. And again, I want to thank you so much for being a part of our team. And I also want to share, if other people are interested in joining our Team Vitamin D and really helping to push this maternal vitamin D initiative, please contact us. Email me, Jen, at grassrootshealth.org. We are growing our team, and we're also going to be building a nice platform where anybody who joins can learn a little bit more about vitamin D, what you need to do, the steps to take to contact your representatives, how to talk about vitamin D, anything that you might need to support you as one of our advocates will be right there in our little online meeting area. And so we will be sharing a little bit more about that soon. Um, Nikisa, one more question for you.
Mhm.
What would you say to somebody that might be considering volunteering as a vitamin D advocate, or somebody who maybe has their own personal story and feels really passionate about vitamin D? What is the importance of using that passion uh, and becoming an advocate?
Um, it's vitally important because this is definitely going to take a grassroots effort. Unfortunately, when you talk to a lot of physicians, we're just not trained to think about root cause in terms of prevention. It's everything is geared towards treatment. Like you have a disease, you treat the disease. But when you talk to a doctor about, well, hey, here's something here that can prevent something, it's like deer in headlights, and they don't know what to do with that. Even when it's things that have been tested in randomized control trials, it's just there's just like a big bridge. So I would say the importance is that this is really going to take a grassroots movement from anyone that can help, because what I've also learned is that you never know who you'll connect with, and they have connections, and it can be more of a grassroots trickle effect to try to get something accomplished. And
Mhm.
it's also not very often I feel like that we have an opportunity to make big impact in people's lives for years to come, that things that can affect like a generation later, so I think that is vitally important.
Yeah. Well, I appreciate all of this time and effort and energy that you have put into sharing the vitamin D message, joining Grassroots Health in Washington, D.C., and then continuing on. We'll share a link to your nonprofit and some more information about you along with this video. And again, vitamin D is possibly the easiest, safest, least expensive way for us to make a large impact, not just for maternal and child health, but for health overall. And, it is Breast Cancer Awareness Month. We call it Breast Cancer Prevention Month because, like you said, prevention is just worth so much more. It can save not just the stress and the difficulties and the poor health outcomes that come along with the diagnosis. But the cost savings are immense as well. Um, so thank you again for joining us today, Dr. Rogers, and hopefully we will have more updates for everybody soon.
Thank you for having me, Jen.